Parents are familiar with ear infections, seasonal allergies, and other childhood ailments now, including COVID-19. But another disease is a danger to our children. It is RSV. Dr. Michael Forbes is a pediatric intensive care specialist, and he's here with some important information for parents. Good morning, Dr. Forbes.
Well, most Americans are focused on COVID-19. It's hard not to be because it's all over the news, and rightfully so. It poses a serious threat to many, many people. In addition to COVID-19, this is the time of year where we see an uptick in the common cold as well as the flu. In addition to the common cold and the flu, healthcare workers like myself are preparing for the RSV season.
So what exactly is RSV?
RSV stands for the respiratory syncytial virus. It's a common, highly contagious seasonal virus that infects nearly every child by the age of 2. The season typically runs between November and April, and it varies a little bit by geography and year to year.
So what do you want parents to look for, to take note of as far as symptoms are concerned?
RSV infects lots of kids every year, and most kids will have only mild symptoms, although a few, those that are born prematurely, are at high risk for serious disease. That's why I've partnered with Rsv to raise awareness about RSV, because many people have never heard of respiratory syncytial virus. Preterm infants are at increased risk because by being born early, their lungs are immature, setting them up for chronic lung diseases as well as lung infections. In addition, because they're born early, they're not afforded the benefit of the infection-preventing antibodies that moms transmit or give to the baby in the end of the pregnancy. Once RSV has taken hold, we know that the disease burden is pretty substantial. Preterm babies in the first few months of life are up to 5 times as likely to be hospitalized due to RSV. In addition, compared to the flu, RSV is more likely to hospitalize infants in the first year of life, up to 16 times more likely than the flu. And about 57,000 children are hospitalized under the age of 5 every year. The symptoms of RSV infection include those that look like a very bad cold. And so you may see nasal flaring, lung retractions or chest wall retractions, fever, and a cough or wheezing that won't go away.
And I suppose most importantly, what can we do as parents and caregivers to take preventative measures?
So how does one prevent this? Well, reach out to your healthcare provider to find out how you can protect and keep your baby protected. In addition, there's a great online resource, rsvprotection.com, that has great information for parents, grandparents, anyone taking care of those kids who are at high risk for serious infection. The other ways that you can prevent the infection is to wash your hands carefully and frequently. Clean the toys off that your kids play with. If you can separate kids that are symptomatic or sick in your home, please do that. And make sure that when you sneeze or cough, you do it into a tissue or napkin and throw it away, not into your elbow, or, which is where you're going to place your baby's head. So we can prevent what we can prevent and protect those babies. And again, remember rsvprotection.com as a great resource to find out how you can do your best to keep your baby safe this winter.
Dr. Forbes, thank you so much for being with us. We'll be right back with more Lifestyles right after this.
Joe has.